Welcome to This Explainer. Today, we're going on this fascinating, incredibly high-stakes journey into a world that, honestly, most people only see on TV, or maybe during their absolute most vulnerable moments. We're talking about the intensely complex, fast-paced environment of critical care nursing. From its humble yet completely revolutionary origins back in the 1850s, all the way to the highly technical, modern intensive care units we see today, we're going to unpack exactly what it means to stand on the front lines of human survival. Okay, let's dive into this. What happens when seconds, literally seconds, mean the difference between life and death? I want you to really sit with that for a moment. In most professions, a bad day means a missed deadline, right? Or maybe a spilled cup of coffee. But in the ICU, a bad day or even just a missed second can mean a life lost. We are talking about an environment where there is absolutely zero margin for error, an environment where highly trained professionals act as the literal bridge between a patient and the unthinkable. So, to understand all this, let's start with Section 1, the stakes of critical care. Because in this environment, minutes and sometimes seconds absolutely matter. Critical care nurses are the frontline responders, dealing directly with human responses to massive, life-threatening problems. We're talking about major, catastrophic trauma here. Highly complex surgeries, or, severe, rapid onset complications of an illness. In these situations, a patient's condition is degrading so quickly that the healthcare team has to intervene immediately. It's this pressure cooker of an environment where time is the ultimate enemy, and immediate, precise action is quite literally your only defense. Which brings us to Section 2, Origins of the ICU. So, stepping back in time a bit, prior to the 1850s, if you walked into a hospital ward, it was just a mixed, chaotic environment. Seriously ill patients, people fighting for their lives, were completely mixed in with the general patient population. Everyone was treated in the exact same general ward, regardless of how sick they were. Crazy to think about now, right? But then comes the Nightingale shift. Florence Nightingale recognized that patients with acute, life-threatening injuries or illnesses had entirely different, unique needs. So she started doing something revolutionary. She began separating the post-operative and critically ill patients from the rest of the pack, bringing them together. Let's move to the timeline and see how this builds, because we can trace a direct evolution here. We start with those mixed 1850s wards. Then, during the Crimean War, Florence Nightingale makes this critical observation. She begins recognizing the acute needs of wounded and recovering soldiers. That realization leads to incredible innovation, organizing post-operative patients into entirely separate areas. And finally, the definitive action that changed nursing forever. She placed the absolute sickest patients physically nearest to the nurses' station for closer observation. Now, placing these sickest patients near the nurses' station, that might seem like basic, everyday common sense to us today. I mean, of course you keep a close eye on the people who are struggling the most. But historically, back in the 1850s, this was absolutely groundbreaking. It was a complete paradigm shift in patient organization, and it literally laid the very foundation for the specialized critical care units we know today. All right, zooming back into the modern day, Section 3, the critical care patient. Now, what's really interesting about this slide is that when we talk about the modern critical care patient, we are talking about individuals who are some of the absolute sickest and most vulnerable people in the entire healthcare system. These are not routine cases, okay? They are facing the most extreme physiological challenges imaginable. There are 4 crucial traits we need to understand here. First, these patients are physiologically unstable. Their cardiac, respiratory, or neurological systems are failing. They just aren't functioning normally. And honestly, even a tiny change can impact their survival. Second, they're at high risk for actual or potential problems. Like, a patient might be perfectly stable on a ventilator right now, but a small disconnect, instantly life-threatening. Third, they are at massive risk for serious complications, like systemic sepsis or multi-organ failure. And fourth, their very survival requires intensive support and advanced technology. We're talking life support ventilators, continuous hemodynamic monitoring, and highly complex continuous renal replacement therapy. So, the crucial point is that because of everything we just discussed, the vital skill here is anticipation. ICU nursing is never, ever passive. It's an active state of extreme vigilance and rapid response. You aren't just reacting when a patient crashes. You're anticipating what could go wrong minute by minute, proactively preventing complications before they even have a chance to happen. These patients can change by the second, which requires this proactive readiness at all times. Let's shift gears a bit and look at the human side of things. Section 4, the human response. Critical care nursing focuses on broad human responses to illness, and the focus here includes both the patient and their family. Because think about it, Serious illness doesn't just happen to a body, it happens to a person, and it deeply, deeply affects everyone who loves them. So the role of the ICU nurse involves prevention just as much as it involves a cure. And this dual role requires just an incredible balance. On one hand, you have the physiological interventions, right? Expertly managing a patient's hemodynamic instability, adjusting life-saving medications, and essentially keeping a failing body alive. But then, on the other hand, you have the psychological interventions. This is providing vital emotional support, calming the sheer terror of a patient who literally can't breathe, and comforting a distressed family standing helplessly at the bedside. It's this delicate, incredible balance of supreme technical skill and profound emotional labor. Which leads us to the people who do this every day. Section 5, the modern nursing workforce. 63,449. According to 2025 data from Zippia, that is the main intensive care unit nurse workforce count in the United States right now. Just look at that number. That's enough to fill a massive stadium. It's a dedicated army of over 63,000 highly skilled, immensely resilient professionals standing on the front lines of our most intense, high-stakes medical environments. Every single day, they walk into a space where seconds matter, armed with advanced science and deep, deep compassion. And I want to leave you with a really profound thought from Tracy, an ICU nurse with over 30 years of experience. She says, "Save one life, you're a hero. Save 100 lives, you're a nurse." I mean, wow. It just beautifully captures the challenging, rewarding, and deeply heroic nature of critical care nursing. So I have to ask you, the next time you walk past a hospital and look up at the windows, knowing that behind them are flashing monitors and patients fighting for their lives, will you ever look at those buildings and the incredible people running those units the same way again? Thank you so much for joining me on this explainer. Keep learning, keep questioning, and I'll see you next time.